Childline TT has received close to 3,000 calls and texts from January 2024 to present. This figure also indicates a rise in the number of young people reaching out for help. This was shared by Program Manager Leevun Solomon, prompted by the recent report of suicide by a teenager and the social media frenzy behind it. TTT News reached out to Childline to remind young people about their options for help. Mahalia Joseph-Wharton has more.
Childline TT has been in existence since 2001 and offers free counseling and ensures that vulnerable and at-risk children and youths have access to quality and confidential mental health and psychosocial well-being services. Program Manager Leevun Solomon said Childline receives a high volume of calls from children and teens as well as texts mostly relating to family-related problems, with parent-child communication being a top issue.
So we do receive a lot of texts from children who would have been victims of cyberbullying, as well as verbal and emotional bullying. What I was saying is that there's not enough light shown or expressed around those issues, because the traditional form of bullying, like physical bullying, takes precedence, of course. But what we need to understand is that emotional bullying, verbal bullying, and cyberbullying, they're equally effective or effective in the mental health of the children.
In some cases, young people just need a listening ear.
Through the text-based service, what we have realized is that there's an amplifying number of children between the ages of 15 to 17 who would reach out to express their frustrations with everyday life. So what we do is provide a listening ear and continued and active support and follow-ups on a daily basis or sometimes monthly basis, and we help them work these issues through from some sort of normalcy.
As a civil society organization, CSO, Mr. Solomon said they are limited in how much they can do.
There's a lot of pushback from parents who do not see, or they don't see counseling as something that would be effective in helping their child, or they don't have enough information regarding the effectiveness of counseling.
When it comes to suicidal thoughts and ideation, the children or teens are referred to their counseling services.
So if a child is expressing some sort of suicidal thoughts via the helpline, we make an internal referral to the counseling service here at Childline, and the counselor would take that child through short-term counseling, and we use that as a measuring mechanism to see whether or not the issue has been addressed on an individual level.
Looking ahead, Mr. Solomon said he would like to see more collaboration with the local CSOs.
His Childline is also a member of the technical working group, which is spearheaded by the Ministry of Health. So there has been some collaboration, but of course, more work can be done.
He has this message for any young person who needs a listening ear during their challenging moments.
I would like to send a message out to all the children of the nation who are facing some sort of emotional turmoil or hardship, that they can feel free to reach out to Childline at 800-4321, or they can visit our website, childlinett.org, where they can access our services by way of WhatsApp and the live web chat. It's free and confidential.
Childline is available 24/7 and is a toll-free helpline. Mahalia Joseph-Wharton, TTT News.